Okay, so you've taken the basic course, and now you know all there is to know about the key components of history, exam, and medical decision-making. But how do you apply this to actual E&M coding? I.e., how do you change your behavior when it comes to actually evaluation and management services? That's what this course is all about, and it's going to change your life when it comes to documenting your patient encounters. The best way to think about E&M coding is that this is how physicians translate their cognitive labor into actual reimbursement. To optimize reimbursement, you have to code correctly. For example, if you inadvertently downcode a level 4 established office patient to a level 3 patient, you would decrease your reimbursement by about 50% for that visit. So it's important to get the code right each and every time. Unfortunately, most doctors simply do not code correctly because they let the documentation happen basically at random, without really thinking about it in a systematic manner. This leads to poor E&M compliance and an imperfect translation of cognitive labor into reimbursement. So the obvious question is, isn't there a better way to apply the key components in daily practice in a way that actually makes sense? And the answer is yes, and it's called rational physician coding. And that's what this course is about. We'll show you how to select a target code for each encounter which represents the full code or correct level of care that matches both the cognitive labor being provided and the intrinsic medical necessity of the encounter. Once the target code has been identified, you can perform and document the key components not at random, but in a purpose-driven manner to make sure the documentation is congruent with the level of care selected. Then, using real-life clinical examples, we'll show you exactly how to quantify your cognitive labor and identify the target code. Then we'll take you step by step through the actual process of completing the documentation of the history, physical exam, and medical decision-making for multiple encounters. The end result is perfectly efficient documentation, which ensures 100% E&M compliance and also optimizes reimbursement for the patient care provided. There are two standard versions of this course, one using the 1995 guidelines and the other using the 1997 rules. We also have versions available for providers who practice in these states under the Trailblazer Medicare carrier, which uses a different point system to quantify the medical decision-making. This activity has been approved for 2 hours of AMA Category 1 CME and also for 1 CEU by the American Academy of Professional Coders.